Welcome back to Face the State on this Sunday morning. We are joined now by the President and CEO of Hartford Healthcare, Jeffrey Flaks, and the Chief Clinical Officer, Dr. Ajay Kumar. Dr. Kumar and Mr. Flaks, thank you so much for being with us here today.
Thank you.
And for our viewers who are suddenly starting to be interested in coronavirus, because many people were sort of like watching it from a distance, saying, it's not going to affect me. Now that all this has happened in the past week, they're paying very close attention. So Dr. Kumar, where did this begin and how did it get to Connecticut?
Well, thanks for asking. So, well, it began in Hunan province in China, and it's a virus which lives normally in animals, and there was a spillover event, and it happens in history, it has happened before. This spillover event led to infection in the human population. And we've noticed since then it has spread across China, and obviously now rest is history. As you know, we are seeing in Connecticut is because of the travelers, some of the infection which has come from other parts of the world. And recently, in the last few days, we have seen an increase in community spread. So this is how the coronavirus has come to our doorstep.
If you're standing next to someone who has it, can you get it?
If you are standing very close to somebody who actually has a COVID-19 and there is a mode of transmission that somebody has a droplet coming in, sneeze or cough or things like that, sometimes by touching as well, because some of the surface carries the virus for several days, you could get it.
Mr. Flaks, how does Hartford Hospital and your other hospitals prepare for this?
So, first of all, we prepare, health systems like ours prepare all the time. We prepare for mass casualty events, we prepare for natural disasters, and we do prepare for pandemic type events. That being said, this is somewhat unprecedented very clearly, but we have plans in place, emergency procedures in place. We activated a command center several weeks ago. We have people working 24 hours a day, 7 days a week, monitoring our response, demonstrating the agility to evolve as the new facts become present. But I just have to tell you, Dennis, I'm amazed at the way people who work in healthcare, this is a moment where you see what they do, their commitment to this work, to people, to helping others. It's really extraordinary. It's inspiring to watch.
And it's important that they stay healthy because they have to treat the sick. But the word is that they shouldn't, that if a person suspects he or she has COVID-19, they should not go to the hospital, correct?
We have a number of procedures in place. So first, we do have a call center that's set up 24 hours a day, 7 days a week. We've already had several thousand phone calls. We have clinicians monitoring those phone calls, listening and speaking with people who have concerns. We have telehealth procedures in place, so we can actually have now people who have suspicious events relative to COVID-19. They can actually have a telehealth visit with a physician. And then we have mechanisms in place up to and including piloting now drive-through testing. So we have a whole series of ways to try to protect the public, protect our staff, and most importantly, take care of the people in need.
So once a person is tested and it's determined that he or she does have COVID-19, what kind of treatment is available? What will be done for them, Dr. Kumar?
So I think there's a spectrum of disease here. A fair amount of patients would be asymptomatic. They may not know that they actually have the disease and they are carriers at the time. Those who are symptomatic or detected positive, there is two different ways to think about it. Most of the patients actually would require run a mild course, especially if you're healthy and if you don't have any pre-existing condition. And they could be quarantined and managed at home. But there are a subset of the patient. That's what the biggest concern is, that this virus especially does affect a segment of the population, more than 65, chronic lung disease, chronic heart disease, chronic kidney disease, immunosuppressed patients, the immunity is not working all that well. Those are individuals who require hospital care. And the way we have prepared ourselves through the call center, through our network, that we can triage this individual to our most acute setting and provide the best care they can get at this time.
Mr. Flaks, there are people at home, some of our viewers are saying, we're blowing this out of proportion. We're being fear mongers. Are we?
No, this has to be taken very seriously. I think very clearly we're working closely with the federal government, with the state government, with other state and regional health authorities. And it's very critical that we plan, that we are building up our response for the worst case scenarios and adjusting accordingly. So this is a very serious situation, and systems like ours are the safety net when moments like this occur, and we have to be ready. So we're taking it extremely seriously.
Explain to our viewers, if you could, Dr. Kumar, why it's important that they close down certain events and close certain buildings. Is it that contagious? Does it, if you touch a doorknob, can you get it?
Yeah, so I think you asked an interesting question, and I think there's a lot of discussion about the social distancing. The world has actually evolved quite a bit lately in the last few days. It's important for people to realize that this infection, we're still learning about it. It's a brand new virus in our system at this time. It can be transmitted through droplet, could be by close proximity. We're learning that it could be transferred through the fecal-oral route. We can transfer through the fomite, which is on the surface. The virus can last for a long time. It's important for people to know that social distancing right now, the large gatherings, the crowds, and other areas where multiple people are collected, you can actually have one person infect 20, 30 people, and then those 20, 30 people can infect hundreds of people. So it's a domino effect, and how we suggest about this, a containment strategy, still, wherever it's possible, is the right thing to do. We, as a healthcare institution, under Jeff's direction, we took a bold step last week when we decided that our colleagues in the Hartford Healthcare should not travel internationally. It's to protect them. It is also to protect our community as well. We want to be ready when the need comes to be able to support the needs. And the travel ban has really helped us contain some of the work we've been doing, and at the same time protect our colleagues as well across the Hartford Healthcare.
What would happen if someone at the hospital was diagnosed with coronavirus? What would the procedure be?
We would treat those people the same way we would treat anyone within the community. So
would you have to close down part of the hospital or anything like that?
It depends what the unique circumstances are, but we have teams on standby, ready to react, and we've done all types of scenario planning on how we would use different facilities, how we could evacuate elements of our facilities, how we could stand up new capabilities. So we have many different scenarios ready to be enacted, dependent on the circumstances.
Dr. Kumar, this is uncharted territory for all of
Yes.
us, but is there any way to walk us through what the next couple of weeks and months will look like in Connecticut?
Yeah, it's difficult to predict the course. If I was a betting man, which I'm not, I think I would recommend that we all continue to be connected to the right source of information, be educated at this time where things are evolving. We are going to see increased community spread. That has already begun in Connecticut. We're going to see more cases over the time. And we have not seen the peak yet. In the next several weeks, we are going to see more peak. So it's important right now, the conversation we're having today, is that how the social distancing, how the travel bans, how the restrictions on some of the events, how the sanitizer use or the hand washing and all those precautions are put in place appropriately, and how the healthcare systems needs to get ready, as we are doing at this time, to be ready to support our community needs at this time.
Are you seeing like this, I know some people have talked about this bell curve, that we might be right here now, it's going to go all the way up, peak, and then it's going to go down. Do you expect that to happen, and when do you think we'll hit the peak?
So it's an interesting question. We are still in Connecticut, and geography matters a lot in where we are right now. I think we are still in the place. We're hoping the curve bell is not going to be a peak and like this, and we're going to be able to contain and go further. But there is a concern. There is a concern about our ability to rapidly react to that. And some of the actions we've done as a large institution to reduce the travel exposure, to create a social distancing policy, we are trying to stay ahead of the curve at this time. And I think our efforts, if adopted by all the large groups and companies, I think would help us as a society to contain that further.
Mr. Flaks, what do you say to people who have like a routine surgery scheduled, or perhaps a physical exam in a medical setting, or they need to have their blood drawn, things like that? Is that safe to do right now?
Absolutely. And first of all, safety is one of our core values at Hartford Healthcare. We work hard to protect the safety of every person we're entrusted to care for. So we advise, we actually have put a text number in place that people sign up for that gives reliable information and pushes information automatically for our patients to receive. We sent out today 275,000 communications to our patient base. So we're working hard to keep everyone abreast of where we are, what the circumstances are today. But unquestionably, in terms of elective procedures, our emergency capabilities, our physician offices, everything is online, well situated, and we're protecting each person we care for.
Our next guest is going to be talking about the flu outbreak of 1918. She's not a doctor, but as a doctor, is there any comparison between now and then?
Well, I think we're living in different times at this time. I think we have a bit more capabilities, but at the same time, we have more challenges as well. The world is a lot more interconnected than it used to be before. There's a lot more global migration and transmission occurs at this time. So challenges are different at this time. The spread of this, something like that, in the global pandemic level is unprecedented at the time. What we have right now is a better healthcare system. What we have is a better preparedness measures. We have systems in place, as Jeff was talking about, especially talking about surgeries and other modalities. We have specialized rooms We have a negative pressures room. So we have a different type of modality present at the time in the healthcare system to be able to deploy to take care of them. So I think we're fortunate to be in a different times at this time.
Dr. Ajay Kumar and Jeffrey Flaks from Hartford Healthcare, we appreciate you being in the program today. Best of luck.
Thank you.
In a moment, we will flash back to that flu pandemic of 1918 that wiped out thousands of people right here in our state. And we welcome your comments on social media. You can find me on Facebook, Twitter, and Instagram.